So thank you very much for joining us. We do appreciate your presence and your time to attend this webinar today. I also do hope and believe that we are all keeping safe in our various offices and home in this challenging period in the world. We want to start by appreciating all our health professionals who are the battlefronts in this fight against COVID-19. And I believe that a couple of people joining us in this webinar today are involved in the fight against COVID-19. Special thank you for holding forth on behalf of all of us. We also do appreciate some of our clients, regulators, investors, bankers, and other professionals that are present in this webinar today. Today, we have people joining us from different parts of the world. We have people from Lagos, we have people from Abuja, we have people from outside of Nigeria. So we do appreciate your joining us. This event is being put together by PML Advisory and Atakov LLP. Just some housekeeping rule before we get started. I'd like to go over a few rules so that you know how to participate in today's event. At any time during the webinar, you can submit your questions to presenter. If you have questions, just type in your question into the Q&A section, and as the time will allow, the presenter will address such questions as much as possible. This webinar is recorded, and we'll be sharing with as many attendees that are present in the webinar today. So why are we doing this? So PML Advisory and Atakov Services are professional service firm. We're an accounting firm, and we, like you can see, our business focus is around audit, tax, advisory, and some highly specialized software. And one of the people we work with are the health sector practitioners. And what has happened in this whole pandemic issue and the announcement of the 100 billion intervention fund by CBN is that we have received calls from a couple of them asking us questions around how they can take advantage of that CBN intervention fund and what exactly they need to do. So that question we kept on getting and getting over a period of time. And initially we wanted to just do this for our very small number of clients. But as we begin to put it together, we got so many other interested parties, and we decided to open up to everybody. So we are very happy to have all of us here. Today, I will be your host, and my name is Abiola Fajimi. I'll be your host, and I'll be coordinating affairs of things here. I've got two gentle, powerful men who will be taking us on the two major sections we have for the day. I have Dr. Gbenga Odayemi, FCA, joining us. And I also have Mr. Adesola Oguntunra, FCA, a net sector impact investor, also will be joining us as one of our panelists for today. We have planned this event for 1 hour, and I hope that we'll keep to that 1 hour as much as possible. The outline for the today event is why we are here, which is what I've just explained to you. Because we are part of consultants that work for some of the health sector service providers, and we've seen some of the challenges the sector has faced over years. So we decided to put this together to share our experience, having worked across a couple of these health sector providers. And then we'll look at Nigeria health sector, we'll look at health sector intervention fund, the way forward, and then end it with question and answer. So I will start by calling our first facilitator for today, in person of Mr. Adesola Ogundiran. Mr. Adesola Ogundiran will be taking us on the Nigeria health sector. Just introduction about Mr. Adesola Ogundiran. Mr. Adesola Ogundiran is a chartered accountant. He started his career working in one of the big four accounting firm, after which he moved on to work with one of the big private equity firm in Nigeria. And from there, he had the opportunity to have worked as the CFO and director for one of the topmost private hospitals in Nigeria. And that's where he got so much immersed into the sector. And has had the opportunity to manage millions of dollars of investment in the Nigeria health sector. He currently works as an impact investor and advises both private and public sector institutions on how to strengthen the health system. Adesola is very passionate about training. He facilitates training for healthcare executives in operational excellence, financial management, governance, and succession planning. Please join me in welcoming Adesola Ogundiran.
Thank you. Thank you, Biola. I hope everyone can hear me. I need to be sure that my mic is unmuted. Biola, is my mic unmuted?
No, we can hear you.
Okay, great. All right, thank you, Biola, and good morning, good afternoon, good evening, good day, everyone, because I know that a number of people join us from outside the country. There are people that join from Canada who are probably in the morning as we speak. Thanks for having me, Biola. So I'll be talking about the Nigerian private health sector, the opportunities, and the challenges. I was asked to take this session because, as Biola mentioned, they've been getting calls, on this intervention fund, and a lot of private providers are here to take opportunity of this. And having worked in this sector, for quite a while now, I understand that the easiest thing is to get a fund. The hard work is what do you do with the fund? How do you understand the sector? How are you going to deploy this fund to generate a fund return? Because this fund is not coming from, from an investor, an impact investor like myself. It's coming from the banking system where, it's all about their own profit at the end of the day. They give you this fund and they leave you to generate return, and pay back with interest. So I'll be talking about the private health sector. What are the opportunities and what are the challenges that we need to look out for? So let me just go into my session without further ado. As an overview, the health sector, as we currently have it, health services are provided, by both the private and public sectors. I mean, this is because healthcare, as it's where, is a social good. So just like education, the public sector and the private sector provide healthcare services. So as we are thinking about our business as private providers, we know that part of our competitors, is the public sector providers. The interesting thing about the public sector is that it seems to be better organized in that you have it organized into the primary, secondary, and the tertiary level of care. You have the local government administration being responsible for primary health care. The state is responsible for secondary care, while the federal government, is charged with the responsibility for, the regulation, the overall stewardship, and providing, tertiary care. And one thing I need to bring out here is that this structure, as it were, is a fantastic structure, is the best way to structure things, but it's also the source of the primary problem we have with healthcare provision in Nigeria. Because the local government authority that are charged, with providing, the basic primary care is actually the least funded and organized level of government. I can't remember the last time I even know who my local government chairman is, or I get involved in local government election, or know who my councillor is. So therefore, this has, it does not allow the healthcare system to be properly funded, organized at the primary level. And this has created a very weak base, for the healthcare system as we have it. So looking at the private sector, on the other hand, private sector is not properly structured and organized, so we know that the private sector provides majority primary level care, such as the reproductive health care, newborn care, management of NCDs and what have you. And of course, malaria, which is Nigeria's most important health challenge as it is now, is responsible for 60% of outpatient visits, and also about 30% of childhood deaths is attributable to malaria. But the private sector is not properly organized. So you have a facility now that this month I can go into a facility and I get orthopedic care in the facility. The next month I get into the same facility, that care is no longer existing. So it's not well structured as it were. Currently, we understand that there are about 4,000 private hospitals in Lagos State only. So these are a whole lot of them small, of very little scale, and capacity. Also, another major challenge, with the private sector is the issue of governance. So these private providers have weak, governance systems, and this affects the quality of service they provide, because you realize that most of the participators in the private sectors, they are single doctor-led facilities, without a properly structured executive management team. There are no transparent, financial systems. Majority don't even, carry out statutory audits. Also, within the Nigerian health sector, we realize that there's high burden, of disease. There's high prevalence of both, communicable and non-communicable diseases, and the key health indicators, such as maternal infant mortality, and what have you, they are worse, even worse than the sub-Saharan African average, and there is high prevalence of diseases such as HIV and diabetics and what have you. And lastly, a major one is that there is poor healthcare funding, both by the public and the private providers. The government allocation to healthcare has been, very, very poor, both at the state and the federal government level. And the private providers, as I said, they are mostly small and weak. They have mostly small and weak system. They are unable to scale or attract funding. So these are the major issues with the private sector, as it were. Looking at the providers, the private providers, and the overarching challenges with provision of private care in Nigeria is that because there are so many, so there's a poor and variable quality of care, and this is due to constraints such as lack of equipment, lack of skills or expertise, weak financial, capabilities. Also, the market, the private provider market, is highly fragmented and unstructured. Just as I said, that the public sector is structured where you have the primary level of care, you have this secondary, you have the tertiary, but within the private sector is highly fragmented. It's unstructured basically, and this inefficient market structure, which is more compounded by the weak governance system and lack of access to capital. And lastly is the poor use of data. We realize that within the private sector, there's a dearth of the use of data for management and decision making. Also, most of the players in the private sectors, they don't comply, with government requirements for DHI's reporting. And also, another issue with the private sector is the fact that the focus is more on curative care rather than preventive care, which is what public health, preaches, So I'll run us through what I consider as opportunities, within the private health sector as it were. And as we're thinking about getting funding or scaling our businesses, these are some of the things we need to start looking at. The first one I'll talk about is the laboratory and diagnostic imaging. There's an opportunity in this space. It is said that within the emerging markets, there are like 70% of diagnoses are inaccurate. So there's need, to have, proper diagnostics and laboratory imaging systems, and this is a major challenge with healthcare service provision in the emerging markets. Also, another opportunity here is opportunity for dialysis business, oncology practice. There's a report that says that about 10.5% of Nigerians have, the risks of having cancer before the age of 75, So, and you realize that oncology care is practically non-existent in Nigeria, and so there's a huge opportunity for us here. This is one of the major reasons for, medical tourism, as it were. Assisted reproduction is another, very important opportunity. Pharmaceutical medicine and managed care is also, there's also a great opportunity in that space, pharmaceutical care, having chain of pharmacy, retail pharmacy, or even manufacturing, there are so many drugs that we import, that there is need for us to localize, the manufacturing of these drugs, and also because of the prevalence of issue of fake drugs and what have you, there's a huge opportunity in this space. Also managed care, we've been hearing about universal health coverage, so there's need for us to have better managed care and payer systems. Also, there's an opportunity for fitness and health clubs. A lot of things around healthcare now is about preventive medicine, not curative. So people are looking for, fitness club, gyms and what have you, health a club where they can have healthy living, healthy eating, and what have you. And there are opportunities, for us in that space. One major one, before I leave this, is health technology and telemedicine. The COVID-19 issue that we find ourselves has taught us of the need, for technology, for a technology-driven practice, and there's a lot of opportunity here, Here I say that medicine is a profession while healthcare is pure business. Medicine is the practice, healthcare is the service. This is one thing that our medical practitioners need to, to understand, that if you have a facility, you have a private facility, what you have is a service. What you are providing, you are in the service industry. It's no longer just a profession. It's pure business, and we need to look at it that way. So I'm going to talk us through some of the things I consider the inherent weaknesses, within the healthcare practice. Issues of substandard or counterfeit drugs. These are issues that we've been dealing with from over the years. Issue of overuse or oversupply. In material management, we realize that there are a lot of wastages that happen within healthcare provision. Issues of unmotivated or unproductive workforce. Being a service industry where we service people that are sick, people that have issues, that have challenges, we realize that this weigh down even on our workforce. How do we motivate our workforce? How do we ensure that they are more motivated and more productive? You have, with the COVID-19 now, you have a lot of nurses and doctors, in the developed world that need the services of psychologists. They need to see psychiatrists. It's a space where it's very easy for your workers to become depressed, quote unquote. So how do you manage it? These are part of the inherent risk. There are issues of poor, supervision as a result of the poor governance system that we've been talking about. Also, we have challenges with the appropriateness of our hospital size. How do you know whether you have enough bed space, whether you have too many bed spaces or less bed spaces? How do you manage the length of stay? Also, there are issues with the medical errors, and professional neglect, which leads to litigation, negligence and what have you. These are inherent risks. These are risks that we cannot eliminate, but we need to manage them. I said here that the healthcare business managers of the future need to continuously devise innovative ways of managing inherent risk to sustain their practices. These are risks that if you don't manage it well, it might lead to the end of your practice, but you can eliminate them. Counterfeit drugs, the productivity of your staff, how you manage your hospital size, issues of medical errors, negligence that can lead to litigation. These are things that you need to continuously, devise innovative ways of managing, but you can eliminate them, as I said. So what sustain a practice is how well you're able to manage this inherent risk. So what is the investment case, for healthcare practice? I was part of the team that raised the first ever, healthcare focused private equity fund in Africa called the Africa Health Fund. We raised it about 10 years ago, because we realized that, previously we've raised generalist fund, we've raised fund that we invest, in practically every space, but we decided sometimes in 2010 and by 2012, we closed what we called the Africa Health Fund, which was a $105 million fund, to invest in healthcare businesses, because we realized that, the opportunities are there, for healthcare to become, proper businesses, for investors to come in and invest in business. It shouldn't just be about, NGOs and what have you, only. And part of the investment case for the Nigerian space, for instance, is the large population and, the growing middle class. I was telling someone that in the past 10 years, I've been hearing that we have a population of 180 million. I don't know whether 10 years ago it was a projection or that was what it was at the time. But even up to now, we're still hearing 180 and some people are saying 200 at the same time. So the population is there and these people need healthcare services. People are giving birth, every other day. They need to visit hospitals. So the opportunities are there. Also, there's a persistent call for universal health coverage. This has become a cliche within the public health world. So my question is, when this universal health coverage comes, who are the people that are going to render this service? When it becomes very affordable to visit hospitals, you don't have to do self-medication for days before you go see a doctor, when you're able to get, affordable healthcare coverage. So investors need to be looking at the space and be preparing for this when it eventually happens. Also, there have been a bit of economic recovery, around the world. There are policy incentives around healthcare, that is making it, an attractive investment space. Also, there's a rising demand, for specialist services. Gone are the days when people just go to the hospital to see a doctor. People now get into it to an hospital and say, I need to see a pediatrician. A baby needs to be attended to by a pediatrician. So we need to look at this and, position our practice to meet all this demand. Also, there's the increased incidence of chronic, and infectious diseases. Now we're dealing with COVID, as it were. Also, the regulatory, policy around private, public partnership in healthcare. You have hospitals now where government hospitals, they are ready to give out their lab, for instance, to be run by private providers. So those opportunities are there. Also, the non-communicable diseases, we have increasing rates of non-communicable diseases like diabetics, BP, and what have you. These are, diseases that needs to be managed over time. And COVID-19, the almighty COVID-19 and the global shift towards virtual or online services. How do we, make investments to ensure that we meet the service provision need, for virtual or online, because so many people don't want to go to hospitals again. How do you consult with your patients, remotely, and ensure that you still get paid for the service? How do we get that done? So those are some of the investment cases that, as investors, they are, what motivates us to look at this space, and think about deploying capital. Lastly, I'm going to just walk us through what I consider some of the improvement needs that we have, within our practice. There's need for automation. We need to automate a lot of our processes, our medical records, our consultation processes, our supply chain system, our procurement system, our financial management systems. there's a major need for automation. So as you are thinking about getting funding your practice and all that, it shouldn't just be brick and mortar only. There's a need, to look at automation to drive your practice. Another improvement need is the waiting time. We always have an argument over this, whether waiting time is an inherent weakness or waiting time actually is an improvement area. But for me, I believe, waiting time is something that we need to improve upon, and we can run a practice where, waiting becomes, very, very minimal. People don't have to wait unnecessarily, before they are attended to. This is actually related to the issue of waiting time, excellent customer service and patient satisfaction. We need to ensure that we improve on our customer service. People complain about going to hospitals in Nigeria because, they are not treated well. It's a nightmare for women to give birth in Nigerian hospitals because, people mock them instead of, being, empathetic with them. Also, the issue of adherence to clinical protocols and SOPs. There are times that a physician over time, because they've done it over and over again, they believe that, we don't need to consult the books. We don't need to, this is how we do it. This is what I've been doing for years. But it's always an improvement area for us to keep, adhering to protocol and having SOPs. We need to have standard policies and procedures, because working in the private sector, I realize that a lot of us don't have policies and procedures. We don't run these businesses as a service provider business. We run it as private practices, as our own professional practice. And, the thinking needs to change from that. Also, there's need for performance management and incentive schemes. You realize that people get into an hospital, they work, and there's no performance management system. There's no robust succession plan. I don't come in as a doctor, as a nurse and say, okay, this is what I'm going to be in another 3 years. In another 5 years, I'll get to this stage. In another 10 years, so we don't have those kind of systems in place. Is a major improvement in that we need to have. And lastly, and before I talk about this, I'll also talk about the improvement in area of the facility itself, how we build our hospitals. We realize that most of the hospitals are, maybe a block of flat that is converted. Even those that are purpose built, we don't get people who are experts in designing hospitals to build them. So, and I tell doctors, I say, I would rather pay, a arm and a leg for an architect who is an expert in designing hospitals and get a local bricklayer to build what he has designed, than just do a design off of my head, and get someone to build. So it's another area that we need to look at, how we design the hospital, how we make it purpose built. And lastly, here is the issue of financial management systems. The way we run our practices, so many hospitals don't have accountants in there. They don't have any monthly reports. They don't use their data to make decisions, about how they run the practice. And this is why, once the owner dies, the business dies. And that is why it's been very difficult for investors to look at the space and put money in there, because there are no proper financial management systems. Here I said that clinicians need to be equipped, with the requisite skill to become business managers, and effective healthcare service providers. We need to leave being, clinician or being medical professionals to service providers. We need to be able to compete in the service industry. So, in closing, there are two ways to make profits. You either increase your revenue, or you reduce your costs. You can increase your revenue, by gaining more market share, by expanding your service offering, or by opening, new branches, as it were, or you reduce your cost, and if you can't reliably, increase your revenue in tough time, because we're in a tough time now, then you should be able to control your cost, and if you can't do it yourself, then you need to seek, expert advice, opinion from people who are able to do this. By and large, the world of medical practice is now so wide and dynamic, and there are no limits to what you can achieve. There are absolutely no limits to what you can achieve. Thank you very much for having me. I'm going to stop here, and then I will I'll wait till the end of I'll just hang around till the end of the presentation, then I will take questions. I hope we've been sending our questions on the question and answer platform.
All right.
Thanks.
Thank you very much, Adesola. I think that was a very good presentation from you. Very insightful and a very enriched section. While we wait for Dr. Odeyemi to get set, I know that the plan is that we'll take questions at the end of the sections. I can see people sending in their questions already. If you have questions, just chat in your questions. We will take your questions at the end of the section. But Adesola.
Yeah.
Yes, before I let you go, there's one question that was very interesting, and somebody asked. There was one quote you have on your slide that said, medicine is a profession. We must see it as but healthcare is a business. Can you just, it caught my attention throughout your presentation. Do you want to just share more light on that briefly before I let you go?
Yeah, so this is coming from the fact that the way private practices has been run over the years is being run as, people personal profession. Private practices are not run as pure businesses. And this is why, you realize that hospitals that are household names when we're growing up, in Ibadan, in Lagos, and wherever they are no longer there. So once the owner dies, the hospital dies. Because it's being run as a profession, as the owner's private personal profession, right? It's not being run as business. So the medicine is the practice, the healthcare is the service. So what you are renting, you are in the service industry. Just like IT company, just like InterSwitch, you're providing service. And that's the idea. We need to start seeing it as service provision, and we need to sustain it so that we can pass it across from generation to generation. So that's the idea.
Okay. All right. Thank you, Adesola. I will come back to you at the end of the section to answer some specific questions that have been raised. We have a couple of questions coming in. Please keep on sending your questions. And so we'll move to the next speaker, who is Dr. Gbenga Odeyemi. Dr. Gbenga Odeyemi is a chartered accountant and is the managing partner for Artecoff Services LLP. He's a very experienced accountant, and a part of things that he specializes on, that we work together on, is in terms of helping people to access some of this intervention fund. So we've done a couple of projects together, and we've identified this sector as one of the sectors that really attention needs to be given, because we need to scale up a lot of these healthcare service providers. So without taking much of our time, so let me welcome Dr. Gbenga Odeyemi. Doctor.
Yes, I'm here. Good evening, everyone. Good morning for those of us that are in other climes. You're welcome to this webinar. And I also thank the organizers for giving me the opportunity to be part of this so that we can share knowledge together. I have been asked to talk on the fund that is readily available now, which CBN, in its magnanimity and because of all the challenges that we see, maybe I would say that COVID-19 has actually made people to begin to see, or government to begin to see, that some sectors have been neglected over time. So for government to think of, or for CBN to think about this fund at this time, it means a lot, especially looking at all the experiences that we've had with healthcare service provider all over Nigeria. Now, I'm going to talk to us about the purpose of the fund. I'm going to talk about the eligibility, who are eligible for it, the terms of the facility, and what are the key requirements. Then I'll stop on the bottlenecks. The support facility that CBN provided, or that the plan to give to healthcare providers, is aims at achieving some basic issues that the industry is having presently. One, we realize that because some of these services could not be provided locally, many of our nationals have to travel outside the country, and as such put pressure on the foreign reserves of the country because they have to pay the foreign currency. So, but if they have expensive, like the bank credits or other form of funds, then they will be able to invest in their business and expand their capacity. And the moment the capacity is expanded, they will be able to render some of these services that are not currently available in the country. So the purpose, one of the purposes is to achieve that. Another one is to give even those healthcare service providers, companies, value chain companies, that is companies that are in the primary sector. For example, in the pharmaceutical industry, there are companies that specialize in materials for the production of the medicine, of the drugs. And that we actually, if all of them are given properly empowered financially, then you will see that they will be able to reduce the cost of healthcare delivery. It's expensive to get the best care because the issue of insurance, we are still managing it and working it into hospitals to get care. Things that government must have been looking at for them to say, okay, let's support this sector by providing this. Who are eligible for this? One, the healthcare product, you can say that those that are in the primary area are also in the distribution part, that also produce or manufacture equipment, wellness centers, and all those ones that are additional, all those companies or things that are additional talked about. Then the other areas are the pharmaceutical, the other services that can be categorized to be an healthcare service. What is this fund all about? There are parties to the fund. CBN is the one giving the fund, but CBN can only give it out through a deposit money bank or a development finance institutions, which are called participating financial institutions. Now, these institutions are the ones we assess the capacity and the character and every other credit requirement of the obligor, that is the prospective person that wants to take the loan. There is one we call the working capital support. And the working capital support is based on the performance, the financial performance of the business in the last 3 years. That is the revenue, looking at how much revenue was made in the last 3 years. So the limit to which an individual can access for working capital support is 20% of the average of the 3-year revenue. And for companies that don't have up to 3 years experience, maybe they just have 1 year or 2 years, they can assess by looking at the amount they can assess will be 20% of the last year turnover, 100 million for an individual or for an outfit. But there's somewhere in the document, in the loan, in the CBN document that shows that you can assess as much as 2 billion for an obligor. But you see, the major challenge with funding, which I need to talk about, is the fact that most of the people that wants to get the funds are not prepared. And what do we mean by the fact that they are not prepared? Many hospitals or many healthcare service providers run themselves as a sole trading business in which sometimes they don't keep records, sometimes they don't know how much revenue has been made, or sometimes the revenue such. When it comes to them presenting their financial statement, oh, it becomes a problem, or even having a financial statement, it becomes a problem. But what a funder wants to see is your history, your financial history. How have you been faring? What have you been able to do over the years? And that is why your numbers is critical. It's critical. And maybe that is the reason why in this particular, to access this particular law, one of the major prerequisites is that you must have your audited financial statement for the last 3 years. Audited financial statement for the last 3 years. So it means that they want to see what is your capacity, how much have you been doing. Then even if you want to use the fund for a project that is futuristic or the project that's a new project, you still have to be able to put the ideas or the knowledge or whatever you want to do together in a framework. It will be clear to the person that will assess the facility, assess your request, that this is what you want to do. And that is why the second prerequisite is your business plan. You know, the major challenge with many of us in the healthcare sector is that we have our plans in our head, but we cannot write it down. And because we cannot write it down, it becomes a problem. And that's what CBN, you know, what they are looking at. They want to see that framework so that they will know whether this money, when we give it to you, you'll be able to turn it around and develop your sector, develop your business, create more value, and when you create more value, you make more profit. Then the other thing that we have to know about it is the fact that it's a cheap fund compared to all the other funds that you see around. Between now and next year, February ending, the interest rate is just 5%. Whether it is working capital loan or the term loan, the interest rate is just 5%. And by March, 1st of March 2021, the interest rate will now increase to 9%. Even with that, it's still a single-digit interest rate. And that should encourage us to put our books in order, to put our things in order so that we can get this kind of facility which is cheap compared to what we see outside. Now, what are the things that you have to have as approval checklist? It is believed that we have banking relationship already. So many of the items that you will see on the approval checklist are what you will have given to the banks at one time or the other. And as such, it should, except the fact that you are now asking for a facility. So your board must now, the members of your board must agree with you that you need that facility and that you want to use it for a certain purpose, which will be spelled out. That's why they will need what we call the board resolution and every other item that I've shown in the list, so that I will not take our time. What are the parties to this facility? I've explained that, but what is the responsibilities of the parties? The first thing is that the CBN gives the loan, right? But they are going to give it through an intermediary, which is the participating financial institutions. And the intermediary, because he will take the credit risk, has a responsibility to ensure that this loan, when it is given, will not be lost. He has a responsibility to monitor the projects. He has a responsibility to check, to carry out his own due diligence, to check the capacity, to check the collateral that the obligor is offering, or the prospective obligor is offering, to check that, yes, the conditions of the loans will be okay. The obligor will be able to cope with it, to maintain adequate record of all the beneficiaries and the facility. For the CBN, they also have to have given out will not be like institution to ensure for the purpose for which. Just make sure that you use the money wisely. Use it for the purpose for which you have asked for it, and use it wisely in such a way that you are creating value, that at the end of the day, you make more profit. What are the bottlenecks? The major bottleneck is lack of record. Lack of record. When you have so many people in the industry, what are your numbers? They are always, what do you mean by that? Oh, where's your financial record? Where I say, oh, I've not even put it together. And if you have not put it together, how do you know how you have been faring? How do you measure your cash flow? How do you know whether you have just been working for someone else? So it's a major challenge in the industry. So that's why we emphasize that, see, you need to keep proper record as a healthcare service provider. Your record of income, your record of expenditure, you need to keep them. The second issue is insufficient collateral. Yeah, but most times we find it difficult to get loans because the collateral that we have is so small, is so in value. The value is so small that you cannot even get, or it's not even properly documented. For example, we have people that have housing necessary, no difficult for them to be breaker, even in getting it. Those some of them that throat cutting loans. They have very expensive loans that when you look at what they are making, they're actually working for the loan providers. And most of these loans are all this hush money that they take to just meet their need, just meet this medical need, without checking whether those money are actually adding value to them or is creating more problems for them. So this facility that has come up now will at least resolve that issue for you, because what you are going to repay is not the interest rate you are going to be paying is far, far lower than what you will get. What you have been getting in the market. Then the other issue is that some guys don't even have interest in banking at all. They don't want to keep money in the banks. As the money is coming, they are just spending it. They are not even saving for tomorrow. They are not keeping. In some hospitals, what we notice is that as patient pays, the patient is paying, someone is waiting for the patient to pay so that they can collect the money and go and use it to buy the medical materials that they need to use. So it means that we don't have a plan. Maybe that's why Shola is talking about SOP, that most hospitals don't have SOPs. So we are just working like a kiosk corner by the roadside. And that's not supposed to be, because when you're rendering service to people, you should render it in such a way that it should be different from the one that you see in the general market. The other issue is inadequate documentation and filing. Sometimes people just want loan, but they don't want to pass through the rigor of preparing themselves. And I think that's a major challenge. I want the result, but I'm not ready to pass through the process of getting it. And for everything that you get without adequate preparation, the challenge is that you are going to waste it. So that's why you have to put it as you have to make it a point very seriously, so that even when it will be easier for whoever is going to help you to still use an incomplete method of accounting to be able to get those things out for you. But you see, when you don't even have the documents at all, it becomes a problem. Then the other issue is the credit rating. Many of us don't even have banking relationships. So how do we get credit rating? So I think I've been able to tell us the parameters for this loan. And what I've noticed is that if you don't give the professionals the opportunity to do something for you, then you want to do it yourself. Yeah, the chances is that you will do it and get it, but the chances are low. But when you use people that understand the way it works, then your stress level will be managed. And then the output will be better. So likely the success rate will be higher when you get the right people to do it for you. I thank you for this opportunity, and I thank you for listening.
All right. Thank you very much, Dr. Odeyemi. I think that was a very rich conversation there, talking to us around the CBN Intervention Fund. Let me also apologize. I noticed that there is some breaking here and there in the course of that presentation. I think I understand there is a bad weather in Abuja. Abuja is a bit cloudy and rainy. He's talking from Abuja. I'm talking from Lagos. Okay. So, well, before we move to the question and answer, I think let's just talk around the way forward. We've heard a couple of things, and people have asked questions. We'll take some of those questions. I think some of the questions have also been answered already. Adesola has been trying to answer some of those questions. Right now, we have about 60 questions that have been asked. Obviously, we may not be able to take all the questions, but one of the things that we will do is that we will collate all the questions, tabulate the questions, and send and share the answers or the responses to those questions with us. I will take some one or two of the questions. In terms of also way forward, I think things that are very important for us as health sector provider is that we need to begin to put some of those issues that have been raised: structure, governance, succession plan, automation. I mean, we need to begin to look at those issues that have been raised by the two panelists. So let me go to the questions, and I will ask you two questions, and then give the two panelists opportunity to answer. Okay. The first question we'll have here is from Olofisonwo Femi, and he's asking, I think this is for Dr. Odeyemi, what is the deadline for the application for this loan, and how soon can it be assessed? And then somebody also asked a question and said, is this loan, how can a startup hospital take advantage of these CBN incentives? So, Dr. Odeyemi, I think you can try to answer those two questions first.
Okay, thank you, Mr. Fajimi. Startup businesses, how would I say it? I would say that the startup businesses can actually access the loan. I mentioned in the course of my presentation that when you have what we call a business plan, it shows a framework and details of how you intend to apply the fund that you will get. And it also shows how you will be able to repay the facilities, because there will be cash flow assessment. And with that, you will qualify, because with your business plan in place, I think you can access the fund, because it shows that, oh, there's an opportunity which you want to take advantage of. And because you are also going to render a service in this sector that particular fund is focusing on, I think you'll be able to access the fund. Then the second question is about, sorry, Faj, can you remind me again?
So the startup, and what is the timeline?
Okay, the timeline, really, the fund just came out, not quite long. The people can actually access it at any point in time. But you see, the challenge is that it's a limited amount. 100 billion is small for that sector. You know, when you compare it with like the public sector, private sector support facility, which is 300 billion. 100 billion is a very small amount. By the time you have few companies, healthcare providers in Lagos applying a loan, might not even be known for all the other healthcare providers all over the nation. So, but I see a situation where CBN will also revise it because there is a provision in the document that CBN's responsibility will involve revising it, checking it. So, but as for the timeline, what it takes from to assess it from beginning to the end, I think there's a 15 days period between when the bank will present to CBN, and then it takes another 15 days for CBN to review. And then I think so within 1.5 months, the whole thing should become a reality. Maximum 2 months should become a reality.
Right.
That's
Thank you for that. Adesola, I've got 2 questions for you here.
All right, I'm here.
Yeah. Okay, so how do you advise patients to handle cost of treatment in a climate with poor insurance? How do you advise patients to handle cost of treatment in a climate with poor insurance? That's the first question. The second question is on the waiting time. You spoke extensively about waiting time. I said, do you have any suggestions on how to improve on waiting time? So maybe take the 2 questions and then I'll see if I can call up 1 or 2 other ones.
Patient to handle cost of treatment. Well, this is about the patient, right?
Yes.
So this might take me into another of my training on finance and how you manage your finances. Everybody have access to HMOs, to health insurance. You know, there are a lot of community health insurance, there are a lot of corporate packages for health insurance. And because we are in a space where we don't appreciate insurance, health insurance is supposed to take the burden, you know, of high cost of healthcare from all families. You know, like my work, for instance, gives me cover for myself and my family, but I have to pay for the cover for my parents because they are retired and they don't have any cover. Because if they fall sick and I don't pay for that cover, I'm going to pay out of pocket, and it's expensive to pay out of pocket. You know, there are times all you pay for health insurance in a year is 50,000 naira. You can do a surgery of 1 million and you are covered. You know, so because we don't do insurance in Nigeria, we don't appreciate insurance. People don't insure their homes, they don't insure their cars. You know, we just do third-party insurance and anything goes. You know, if you insure your car, if your car gets stolen, you're going to get a substantial sum back. You know, and that's what insurance is all about. Because if you don't have insurance, you walk into a facility, you pay out of pocket. And I kid you not, healthcare is expensive, paying out of pocket. You know, so I mean, for patients to handle it, this is like, you know, teaching people about personal finance and how they manage their finances. You know, it's a patient business. You know, it's not the provider's business. How they handle their, you know, their healthcare. I mean, I've seen instances where, you know, someone's wife had a baby and he had to do CS, and the guy's running around saying, you know, I don't have money. They said the CS is so thousand. I'm like, it wasn't an emergency. Your wife was pregnant for 9 months. What were you thinking? You know, so it's all about personal finance, how we think about our finances, which is another training entirely. You know, talking about waiting time, you know, how do you manage waiting time? You know, you have to be conscious of when people come into your facility. I've been to facilities before where, you know, I just got in and I was supposed to go to a place to take a paper or something, but nobody told me what to do. You know, you need to treat every patient as if they are coming into that facility for the very first time. You know, and that's one of the major challenge with how we do customer service in Nigeria. You know, I went to DSTV one time, you know, to do something. And when you get into DSTV office, you know, you are supposed to take a tally and then go sit down, and 5 people are called at a time. But when I got there, I took the tally and I saw that people are lining up in front of the service providers. You know, those are the 5 that has been called per time. But I just went to join people that are lining up. You know, and after a while, someone stood up and said, you know, I'm trying to bypass the thing. I said, I'm coming here for the first time. You didn't tell, nobody told me, you know. So service provision, you need to tell people, you need to see everybody that walk in as if they're coming in for the first time. You know, and you need to ask them questions. You know, how long have you been staying here? Who are you waiting for? Who do you want to see? Have they attended to you? There has to be a floor manager at every point in time in an hospital. Someone that move around, you know, and talk to patients, find out what they are doing there, whether they've been attended to, what are the challenges, you know. But you get into hospital until people start boiling to say, what the hell is going on here? nobody actually care, about how long you've been staying. And you use technology to do that as well, because you have some EMRs now that once you get in, it records the time that you get into the facility, so that even at the end of the month, you can do an analysis of your waiting time, how long people take before, they get into your facility till they exit. And, I use that to know where people are spending more time. That's why I said we need to use data to drive our practices.
Okay. All right. Thank you for that. While I still have like 4 or 5 more, I will take 2 more questions and then share 1 or 2 additional information with us. But before then, we'd like to have feedback from all the attendees. So we'll have a small poll we are taking, and please just complete this exercise while I read other questions. We'd like to have your feedback about this section. This can go a long way in how much or whether we need to determine whether we need to do this again or not, and how beneficial has been the section to you. So please kindly complete the poll. I think the poll is being displayed now while I asked Adesola 2 other questions. So we have here. This question is for you, Adesola. How does one do well in an environment where there is poor regulation and a lot of quack that you have to compete with? So this person is asking, how do you survive? I think this is about business strategy. How do you survive in an environment where there is not so many, where there are quacks? And the second question, which is one of the areas I'm very passionate about, is talking in terms of digital transformation in the health sector that cannot be sustained without policy review. Telemedicine is here. So maybe you want to just say 1 or 2 comments around the old digital transformation that we are expecting in the health sector, the telemedicine of a thing, and then the poor regulation. So in 1 minute or 2, please, Adesola, just quickly answer that.
It's good you raised this issue of poor regulation. I've given this feedback to so many, my audiences, talking to AGPMP, talking to Guild of Medical Directors, Association of Radiologists in Luth at the time, regulation. We need to be more involved in regulation. The providers, we need to be more involved in regulation. I was telling them that I don't think they hardly, appoint the CBN governor in Nigeria without the bankers knowing they are involved, because those are the people that push, policies that affect them. The regulation has been very poor, and the private providers also, it's for our benefit at the end of the day, the regulators are doing what they are supposed to do, And you talk about quack, how you differentiate yourself in the market. Is it that you use the cost, or you use the quality, as it were? So, the quacks are not your problem. Your problem, you have to carve a niche for yourself to say, this is an hospital where customer service is top notch. This is an hospital where waiting time is minimal. This is an hospital where we are down to protocol. People are also looking for value, not necessarily, things being cheap. We had this issue while we invested in the dialysis chain, whereas you have other dialysis practitioners that are doing a lot of quackery, not proper clean water, they don't do the normal session they're supposed to do, the normal hours. People do all sorts of things, and, your results will show for you, so you need to also be able to project yourself to let people know what you are doing and how well you are doing it, basically. So you're talking about digital transformation. I didn't really get the question, but I think the person is just wondering, how is this going to happen? How prepared are we for this? This has happened already, in finance, in fintech and what have you, and it's going to come to healthcare as well. People want to be able to consult, from the comfort of their home. There have been a lot of artificial intelligence powered, consultation platform now, where, I was chatting with my doctor the last time, but you still need to explain yourself, who you are, where you're from, your history, before you can, consult. But if you have such platform, once you log onto the platform and you connect to your provider have all your history, all your data, all your consultation history, and there and then your provider can attend to you. And also, there have been diagnosis centers even in Nigeria where, You know, you do all this, your MRI, your CT scan, the person that is reporting is not there. People report from outside the country, you know. So you take your images is transferred to this person, you know, it doesn't have to be there anyway, because all it needs is the image. You report on the image. So you have access to the best of radiologists around the world, you know, because of technology. You know? So we need to be prepared for that, you know.
Okay. 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 I think it's been a long section. It's exactly 6 minutes after this, after 1 hour, 6 minutes. This webinar was set for 1 hour. I'd like to thank everybody for joining. The contact of the 3 people, myself as your host, Abiola Fajimi, Benga Odeyemi, and Adesola Ogodera are up on the slide. If you need any assistance, you can always reach out to us. Our emails are there. Just send us an email and we will respond to your question appropriately. So thank you very much for joining. I wish all of us a very good evening, and please let's all keep safe. Thank you very much.